Welcome back. Now, to treat most conditions these days, medication's the only answer. So the idea for many people of a drug-free treatment sounds too good to be true. But if you're suffering from depression, insomnia, even obesity, and don't want to rely on pills or potions, this new virtual therapy could help. Basil Melandris with the Adelaide patients who say they feel much better for taking the leap.
They'd be amazed at the results that some of these people have got.
My two girls are saying, Daddy, you know how much more relaxed you are.
When you're sleep deprived, it just affects everything in the rest of your life. How you work, how you interact with your kids, everything,
Seeing the world through different eyes.
In a moment, I'm going to take you into a relaxed state.
You comfortable there? You all right?
Imagine being taken to a place, a virtual reality, where there's relief from pain, you sleep soundly, and your fears and inhibitions are momentarily taken away. And the best part is, there are no drugs or medication required.
Having non-drug therapy I think is always a good thing.
It's called VRT, or Virtual Reality Therapy, a 20 to 50 minute hypnotherapy session using sounds and pictures to treat a range of symptoms, including depression, insomnia, smoking addiction, and even obesity.
In Melbourne, virtual reality therapy was developed in the burns units of hospitals. Now, I think if you can imagine a burns patient, when they have their dressings changed and adjusted, that's their most painful time.
Here in SA, Dr. Peter Stroud and his wife Anne are registered users of the TGA-approved device. Travelling between Adelaide and the Riverland, they offer VRT to a growing number of clients, including post-traumatic stress sufferer James Harris.
All I said to the person next to me, he said, watch out, they're going to hit us. And next thing I knew, I was upside down. The cab had actually flipped onto the road, pushed the car out like a bulldozer.
For 9 months, the Loxton truckie has been racked by guilt following a head-on collision near Hay in New South Wales.
There's delayed shock in it, of course, and thinking that, you're a murderer or mass murderer.
You really thought that?
Yes. I knew deep down I wasn't responsible, but you still had that...
guilt?
The guilt and the shame of it,
While James was not responsible for the tragic accident which claimed the lives of 2 people and left him with multiple injuries, James found himself reliving the horror every day.
And when they I said, look, would you like to try this new therapy that we got? I was fairly hesitant about it, but I reluctantly, I thought, well, I'll give it a go and see what happens.
So what did happen when the goggles came on and the lights went out?
It showed you different coping skills of dealing with the stresses of the accident.
The imagery can include pictures of beaches, forests, a variety of different natural environments. It can include people, it can include animated images, totally calming, totally meditative, and designed to distract the conscious mind so that it reaches directly into the subconscious mind.
I heard about it through a therapist and thought I'd give it a shot.
After suffering a breakdown and sleep deprivation earlier this year, Norwood dad Wayne Henry also started a course of the therapy, which included listening to meditation CDs before going to bed.
And that helped, I guess, to relieve the anxiety, to have that translate into more consistent sleep and better sleep. I haven't had a sleepless night in 3.5 months.
Okay, and put those in your hand, one on the other hand. I'd like you to do some bicep curls, one at a time. Yep, that's it.
Apart from the subliminal audio-visual experience, Anne Clark also incorporates a number of tools into the sessions, such as weights, which she says encourages exercise for obese patients, and this thing.
And I'm going to put a strap on your wrist, and I want you to listen to the instructions.
It's called an AccuStrap, a distraction technique for people who have cravings or addictive personalities. Simply press the button on your wrist and your thoughts are redirected elsewhere.
We've had good results with children, particularly children who've been referred with behaviour problems in school. And we've used it also with a lot of clients with quite a lot of pain
Does it fool the mind into thinking there is no pain?
No, it doesn't do that. It doesn't fool the mind at all. It accesses the subconscious mind directly. It's not designed to take away pain, it's designed to make pain more livable.
As for James Harris, his injuries have meant he can't drive trucks for a living anymore. However, he's no longer scared of the road, and the phobias that haunted him since the accident have virtually disappeared.
The old James is back.
Yeah, well, an improved James. I'll never be the same person I was before the accident, but I refuse to let it rule my life.
It works with people who are really into technology. It works really nicely with children because they readily understand it. It's an interesting adjunct to people who've tried everything. I've had pills, I've been to a naturopath, I've been to a doctor, I've tried running, I've tried jumping, I've tried standing on my head, I've tried yoga. I've tried a whole lot of things. This is something different.
So if you're interested in finding out more, head straight to our website, todaytonight@adelaide.com.au. But do stay with us. We'll have more for you right after this break.